And we're going to get started. All right. Good afternoon, everyone. I'm Alice Nelsner, chair of the IHI, the Inland Empire Coverage and Health Initiative. And I'm also the executive director of the San Bernardino County Medical Society. The IHI, the Inland Empire Coverage and Health Initiative, as you know, is a coalition that strives to ensure health coverage and services for children, families, and individuals throughout the Inland Empire. So we welcome you today to the 9th annual IHI Legislative Forum and our second virtual forum. We're so excited that you've joined us all today. Today's topic area is COVID-19 updates and vaccine distribution in the Inland Empire. Obviously, COVID-19 has dominated our lives in every way for the past year, from work to social to school to healthcare and even mental health. So we're going to explore all of these things today with a focus on the vaccine rollout in our region, including ways to make sure we are including our communities from the standpoint of diversity and equity in the vaccine effort, as well as those who are vaccine hesitant. One interesting note, it was exactly a year ago this week and into next week that were our last 2 normal weeks of business before things were shut down and before our lives changed unexpectedly. It's been challenging, but I really do think we've learned a lot in the past year, not just about new medical technology, not just about how to use Zoom, but also hopefully about how to work together more effectively. So as we get started, a couple of quick items. During the presentations, we're going to mute everyone out of respect for our speakers. And when it's time for question and answers towards the end, we're going to use the raise hand feature on your Zoom dashboard. And Soteria from our SBCMS staff will be facilitating your questions. So we'll start taking those questions around 1:15 once all of our panelists have had an opportunity to answer the questions. So if you have a question, again, be sure to use the raise hand feature on your Zoom dashboard. And if you have any problems or questions, go ahead and use the chat and send either myself or Janice Solorio or Soteria Cobb a question and say help, and we'll walk you through it. First off, we're going to have a brief presentation about the activities of the IHI Advocacy Task Force from Alexandra Bravo, who's the Community Engagement Manager with Molina Healthcare and the IHI Executive Board member. Alex, welcome.
Good afternoon, everyone. It's so nice to see so many familiar faces. Thank you for that warm introduction. And as mentioned, my name is Alex Bravo. I'm the Community Engagement Manager over at Molina Healthcare, and I'm also part of the Advocacy Task Force at the IHI. And a little bit about this task force, we focus on the education and advocacy of children and family health issues of the general public, professionals and legislators at the local, county, regional, and state levels. The task force aligns with the state and regional CHI initiatives and platforms. A little bit of what we do at this task force, we support the IHI's annual legislative forum. Here we are today, and quarterly health education forums. We also coordinate legislative advocacy activities at the county, regional, and state, federal levels, as well as supporting sponsorships of key legislation such as AB2 in 2018, promoting health coverage for all California college students. Currently, the task force is comprised of yours truly. We also have a representation from St. Mary's Hospital, the United Way of California, and Blue Shield. And my ask of you today is if any of you are interested in being part of this great task force, please feel free to reach out. You can reach out via chat. You can reach out to any of the task force members. And we will surely get back to you, and we extend a warm welcome to be part of the task force. Thank you.
Thank you, Alex. We really appreciate that update and all you do for the IHI. Next up, I am so honored to introduce our keynote presenter. He's someone you probably all feel like you know well from seeing him in or on the news representing Riverside County. Dr. Cameron Kaiser, MD, MPH, FAAFP, has been the Public Health Officer for the County of Riverside since 2011, serving as the Medical Director and Legal Authority for the County Department of Public Health. A family physician by training, he has worked for the Department of Public Health since 2006, including in the County Clinic Network and over 14 years as the County Tuberculosis Consultant, through which he continues to treat patients. He completed his MD at Loma Linda University, his residency at Kaiser, Riverside, and his Master of Public Health at the University of California, Berkeley. And he holds the rank of Fellow in the American Academy of Family Physicians. In addition to his statutory duties, he's also an assistant clinical professor for the Department of Preventive Medicine at Loma Linda University, an ex officio commissioner for the first 5 Riverside County Children and Families Commission, and the health officer co-chair for the Inland Empire HIV Planning Council, a member of the Board of Directors for Health Officers Association of California, and the Region 9 Board of Directors member for the National Association of County and City Health Officials. Welcome, Dr. Kaiser.
Good afternoon, and thank you very much for the kind introduction. My name is Dr. Cameron Kaiser, and I am the Public Health Officer for Riverside County, and I'm honored to be the keynote speaker for today's event. March 7th, 2020 was our first confirmed case of COVID-19 in Riverside County, and our board chair, Supervisor Spiegel, and Supervisor Perez will recall that I have observed many times during the earlier days of the pandemic that it won't be over until there's a vaccine. And today it is incredible to realize that we have not 1, but 3 vaccine candidates, all of which provide solid protection, and one of them with just a single dose. Although we are still keeping an eye on the impact of current COVID-19 variants and the potential for new and potentially intractable ones, as there always is with any virus that spreads widely, I will talk about how we as a region are nevertheless successfully harnessing these weapons against the pandemic so we can put COVID-19 into the history books where it belongs. I'm going to speak primarily from the perspective of Riverside County for obvious reasons, not least of which being my employer, but also as we are one of the so-called first wave counties under the new third-party administrator system through Blue Shield, and I think that our initial experience with that process will be particularly instructive. But I would be remiss not to point out that by and large, the same issues that apply to us in Riverside County apply to our colleagues in San Bernardino County. As it stands now in Riverside County, our residents have received 547,805 doses, which is almost everything that we have received. That number includes county residents vaccinated out of county, as well as doses administered through CVS, Walgreens, and other federal vaccine program participants. In San Bernardino County, 401,129 doses have been administered to their residents, which is also most, if not all, of their allocation. And getting doses out quickly is vitally important, as we are seeing a national plateau in case declines, and current predictions for California statewide and regionally may be bottoming out. So we really do need to get stable immunity for more of both counties' residents and keep the pressure up with good precautions so that we can avoid another surge and make further progress on immunity. Additionally, although we are keeping a close eye on what it means for our case incidence, obviously counties understandably want to take advantage of changes to the tier structure, where greater statewide vaccination rates will allow counties to enter less restrictive tiers more quickly than before. Either way, the key is more doses and more arms. To understand how the state vaccination initiative is expected to run, I think it is first useful to discuss the relationship between local health departments and the state. California has 61 local health jurisdictions, 1 for each of the 58 counties, though 2 counties have merged theirs, and currently 3 independent city health jurisdictions. I act either de facto or explicitly in city ordinance as the health officer for Riverside County's incorporated cities as well, and I believe that the same applies to my opposite number, Dr. Sequeira, in San Bernardino County. California is an example of a highly decentralized public health system. This stands in contrast to other states like Georgia and Florida, for example, where most, if not all, local health departments are actually branch offices of the state. We have true freestanding local health departments in California, and most public health decisions therefore occur locally under the authority, either directly or delegated, of the physician public health officer. In non-COVID times, this would relate to things such as sanitation, inspections, stay-out orders, rabies control, and particularly orders of individual quarantine or isolation for dangerous communicable diseases, primarily tuberculosis, but also others. Similarly, this also covers all the many day-to-day operations that health departments do, such as statistics, vital records, public health nursing, children's medical services, chronic disease, preparedness and response, and of course our public health lab. This is a direct consequence of what we call realignment, where after 1991, most social services and health services delivery is done at the local level. The state still does set a floor for policy, which is based both on state law and regulation, and operationalized both by the portions of vehicle license and sales tax dollars passed through to counties to cover those realigned functions, as well as other grants we receive from state to federal agencies. It may surprise many people on this call to realize that most health departments are actually primarily grant funded. Relatively little of our budget comes from categorical straight line money. But this decentralized scheme is also the same at the federal level. While the CDC can set recommendations, it is states that implement them as they see fit, using applicable federal law and regulation as the floor. Likewise, as a general rule, the state of California tasks programs with particular policy goals and parcels out grant money, material assistance, or realignment funding based on it, but counties operationalize those programs and may put other layers on top or tweak them to meet the local need. This is, as an example, how we do COVID-19 testing. We have state testing sites that the state operates and currently pays for, but we supervise them and direct where those resources go and how they run, and we layer locally or previously CARES Act funded additional testing resources on top of it. The original playbook for the COVID-19 vaccine rollout was to utilize this already existing pipeline. And I think that we as counties do a very good job with that. What has really spoiled the soup, however, is a dramatic shortage of available vaccine. And if it was simply a matter of opening the gates and getting people in and going first come, first served, then that's actually relatively straightforward because that's more a matter of crowd control than anything else. Instead, because of limited supply, we are now in the position of having to vet and prioritize people who show up for shots, and every county, and our 2 local counties included, has taken slightly different stances on those different populations. The state's intention with the third-party administrator, for which they have hired Blue Shield, is to level those differences and to have common statewide criteria for what is called the State Vaccine Network. Now, there's no template for this. Near as we can determine, this is the first use of a private entity to manage a statewide vaccination campaign. As per their contract with the state, Blue Shield is responsible for rounding up, credentialing, and stocking medical providers with vaccine instead of the local counties registering them ourselves. They maintain MyTurn, which is a state COVID-19 vaccination scheduling system, and they ensure that data gets into CAIR, that's CAIR, which is the vaccination registry used by most of the state's jurisdictions. Most importantly, however, they are specifically charged with developing a recommendation for how vaccines should be equitably distributed throughout the state. Specifically, Blue Shield is required to look at equity gaps, hotspots where the virus has hit particularly hard, providers in regions that aren't getting enough vaccine out, and of course, absolute population. The state would then determine whether to accept that recommendation, although it is likely the committee in charge of such approvals would. The picture is less clear about the TPA's relationship with counties and what its proposed contracts with counties mean. Riverside County is, as mentioned, first of Blue Shield's first wave, along with several other inland and smaller jurisdictions. But we still have a lot to figure out about what ways the TPA benefits the county, what additional responsibilities the TPA places on the counties, and how this actually relates to us getting those precious vaccine doses, which is really the biggest question of all. The MyTurn system itself is also a notable point of contention. When it works, it does work well, but the code-based system used for gating appointments has been repeatedly abused, and because MyTurn is online only, makes it difficult for those who lack a computer or reliable internet access to schedule appointments. Fortunately, the state did recently open up a telephone hotline for English and Spanish-speaking individuals to assist people in those categories, and there is availability through other languages via translation. But that code-based system for MyTurn will still need some rethinking, and follow-up for second dose appointments, of course, has been quite difficult. Our 2 counties are also dealing with a shifting vaccine eligibility picture. Phase 1A for healthcare workers and long-term residents, and at least the age-qualified 65 and up first part of 1B, these were relatively straightforward to take care of as these dealt with well-defined, fairly fixed populations where eligibility could be confirmed without a lot of fuss. However, the sector populations for agriculture, for food, education, childcare, and emergency services in the latter part of 1B are harder to define, and the state has not clearly laid out a procedure for getting a common, consistent answer to who falls into these categories or who are higher priorities. Additionally, the state is expanding March 15th towards individuals 16 to 64, with certain chronic medical conditions or those chronic or lifelong disabilities where they are more likely to develop life-threatening illness or death as a complication from COVID-19. Now, individual providers such as pharmacies and physician practices can, of course, vaccinate their own patients whom they know. But county vaccination locations are still the primary way many county residents will be vaccinated, including for those who legitimately have those conditions, but no primary care provider to attest to them, or their usual primary care provider isn't enrolled to administer a vaccine. Now that the TPA plans to take over provider enrollment from the counties, the connection to physician practices will become a more acute problem because it isn't actually clear if the TPA is even enrolled any yet. The final question is what a statewide vaccination picture means for county-specific stewardship. Although it is somewhat hyperbolic to say that the TPA erases county borders, county-specific changes to vaccination tiers would certainly be discouraged and large changes would likely not be permitted. And there's additionally been language discussed that counties can't turn away residents from outside of their region. Vaccine tourism has so far become a small but hotly debated problem, and a well-stocked county trying to serve its own disadvantaged residents may end up seeing those doses going to out-of-county residents who are able to travel and get appointments more easily. The current state holdback of 40% in a tier for disadvantaged residents in lower health outcome quartiles is at least in part a reaction to this possibility, as only about 16% of the total vaccine administered statewide has gone to bottom quartile regions as measured by the Healthy Places Index, compared to 34% in the highest quartile. It is reasonable to assume, unfortunately, that at least part of that 34% benefited from opportunities poor individuals have not been able to take advantage of. We are also working very hard on public messaging to overcome vaccine hesitancy in all communities, low and upper income alike. And this has certainly become more acute with public perception of the Johnson & Johnson vaccine in some environments, which is frankly absolutely undeserved. Far from being a second-tier vaccine, the Janssen or Johnson & Johnson shot is well tested, protects people from serious disease or hospitalization at least as well as the Moderna and Pfizer candidates, is much easier to store and distribute, and just needs a single dose. And its production is also more similar to typical vaccines, which is obviously advantageous. Frankly, if the J&J vaccine had come out before the mRNA vaccines, and I'm not poo-pooing them, those have been unqualified successes. The J&J vaccine is what we'd all be getting simply because of all those attributes. And we want to make sure we're not moving from a situation where we have plenty of people and not enough doses to a self-inflicted one where we have plenty of doses and not enough people. Because even if we ignore the new variants completely, we will still need somewhere between 60 and 75% of the population immunized to have credible overall immunity. This means consistent messaging from our leadership, coordinated delivery of the facts from our medical and public health authorities, and quick response to the pernicious misinformation that has really plagued the COVID-19 pandemic from the beginning. As more people see more people getting the shot and it becomes more familiar, it becomes more obvious that's what they should do. And a lot of people's lives have been touched, for bad or for worse, by COVID-19. And not just hospitalizations and deaths, but also the small but growing population of long COVID sufferers. And those sobering studies, unfortunately, are probably the best impetus right now for why people are so desperate to be vaccinated. The 50,000-foot view on vaccine rollout, however, is cautiously optimistic. J&J's first week 3.9 million doses nationally joins the 3.8 million Pfizer and 3.3 million Moderna vaccines, plus additional allocations for our federal and tribal partners. But every single dose of the J&J is a complete series, so it gives us the potential to get a lot more people vaccinated a lot more quickly. And as supply improves, we can hopefully then start shifting back into a more typical point of dispensing scenario where we just move them in and move them out without a lot of preamble or having to mess around with pre-qualification, which is a necessary evil in these times of shortage, but will quickly wear out its welcome in times of plenty. But even though it is the natural state to overpromise and underdeliver, the unescapable observation is that we are in a position that might have been unthinkable just 6 months ago. There are 3 excellent vaccines in our hands today. And on March 7th, 2020, that day seemed like a long way away, but today it is here. And if we can be faster than the variants and hold the line on further transmission by keeping precautions solid until our population is protected, we can beat back COVID-19 in the Inland Empire. We can learn those hard lessons that we need to from the pandemic, and most importantly, move forward, hopefully, into a brighter and more normal-looking future. With that, Ms. Elsner, I'll hand it back over to you.
Well, thank you so much, Dr. Kaiser. That was incredibly comprehensive and provided so much clarity. We truly thank you for that. And we thank you for everything you are doing every day to help everyone in this community. So that was awesome. Thank you. All right. I now have the privilege of introducing the MC for today's panel discussion, Riverside County Supervisor V. Manuel Perez. And I must say, this is always one of my favorite introductions, not only because Supervisor Perez was a member of the IHI board, as well as chair of the IHI Advocacy Task Force, and therefore was responsible for initiating this very event, the annual legislative forum, but also because he's such an inspiration. Supervisor Perez represents the eastern 2/3 of Riverside County as the 4th District Supervisor. Incorporating nearly 5,000 square miles, the 4th District stretches from Palm Springs and Desert Hot Springs south to the Salton Sea and east to Blythe and the Colorado River. Supervisor Perez joined the Riverside County Board of Supervisors in 2017 and in 2018 was elected to a full 4-year term. He worked in the fields of education and community health, helping the underserved. He previously served on the Coachella Valley Unified School District Board of Trustees in the California State Assembly and on the Coachella City Council. Born and raised in the Coachella Valley, the son of immigrant farm workers, Supervisor Perez attended the local public schools and graduated from the University of California in Riverside. He taught at a local middle school and went on to earn a Master of Education degree in Administration Planning and Social Policy from Harvard University, which shows you if there's a will, there's a way. It's my pleasure to welcome and turn over the program to our MC, Riverside County 4th District Supervisor V. Manuel Perez.
Well, thank you for that, Allison. I appreciate you and I appreciate the membership of the Inland Empire Chai, and I miss you guys as well. I appreciate our meetings and our discussions as to how we can advocate on behalf of our communities and ensuring that ultimately our constituents, our residents, our communities overall have access to healthcare. And I guess that's why we're here today, right? That's our purpose. And so thank you for that, Allison, and for the board and for taking care of me after my my legislative days and welcoming me and being part of such an important organization. I appreciate that. Hey, Dr. Kaiser, like always, we appreciate you and thank you for your presentation. I'm going to review that again. Obviously, there's a lot of great information, and I think I can speak on behalf of my colleagues on the Board of Supervisors for Riverside County. I know that our chairwoman is on as well, and I'll be introducing her, Karen Spiegel, in a bit, but 2020 was tough. I'm still licking my wounds. And I'm sure you are as well, Dr. Kaiser, but you did and you are doing an outstanding job. And there was no script for any of that. But I just want to say thank you for keeping your head up and for dealing with the challenges from, quite frankly, both sides of the aisle. Because it's very real what we felt and what we continue to go through. So I just want to say thank you. And I was and had the opportunity to be part of the task force to inaugurate, if you will, back in the day, this type of forum where we tried as an Inland Empire coverage and health initiative attempt to communicate with, coordinate with our local electeds so that our ideas, so that our voice would be heard at a state level, even at a federal level, at a regional level with county, and at a local level with city councils. Very important work, and I appreciate this type of forum. So with that, I'm also wanting to let people know that I'm juggling right now. You see me here. Over here, I have another computer, in which I am on my AQMD board meeting, in which we're going through 2 hours so far of public testimony. And there's going to be a very important vote eventually. I don't know when it's going to happen, but I may all of a sudden say aye or no, yes or no, and then come back. So I just want to let you all know that's what's happening on my end here as we are speaking in real time. With that said, though, I have the opportunity here, the fortunate to introduce 3 great individuals who care. We have State Senator Rosilicie Ochoa-Bogh. We have San Bernardino County Supervisor Don Rowe. And we also have our chairwoman, my chairwoman, who I appreciate, Riverside County Supervisor Karen Spiegel. And so let me read a little bit of their intros and their biographies so that you get an idea of who they are before I raise the questions. Rosilicie Ochoa-Bogh was elected in November 2020 to represent the nearly 1 million people of the 23rd State Senate District. The district encompasses portions of Riverside County, San Bernardino County, and Los Angeles County, stretching from Rancho Cucamonga in the west to Menifee in the south, and including several San Bernardino mountain communities and a small slice of the high desert. Senator Ochoa-Bogh is a native Californian and the daughter of Mexican immigrants. She graduated from San Bernardino High School and the University of California, Santa Barbara, and earned her teaching credential for California State University, San Bernardino. She taught English language learners at the elementary school level before becoming a real estate agent. Senator Ochoa-Bogh is a past member of the Yucaipa Calimesa Joint Unified School District Board and was a proud realtor for 18 years, helping many achieve the American dream. San Bernardino County Supervisor Don Rowe, a Southern California native. San Bernardino County Supervisor Don Rowe joined the San Bernardino County Board of Supervisors in December 2018, representing the county's 3rd district. Elected by her 3rd district constituents in March 2020, Supervisor Rowe began her first full 4-year term in December 2020. Prior to joining the Board of Supervisors, Supervisor Rowe served on the Yucca Valley Town Council from 2010 to 2014. Supervisor Rowe is focused on making San Bernardino County a business-friendly environment, improving infrastructure, and strengthening public safety. Riverside County Supervisor Karen Spiegel. Madam Chair, Spiegel was elected to represent Riverside County's 2nd Supervisorial District in November of 2018. The 2nd District includes the cities of Corona, Norco, Eastvale, Jurupa Valley, and the western half of the city of Riverside, as well as the unincorporated communities of High Grove, Coronita, El Cerrito, and Home Gardens. Supervisor Spiegel began her political career as the elected city treasurer for the city of Corona in 1996. After 6 years as treasurer, she embraced the city council elections in 2002 and served the city of Corona as council member for 16 years, serving as a mayor 4 terms. Supervisor Spiegel has been credited for her leadership in regional transportation issues, collaboration, and regional partnerships. She is known for being an energetic member of the community with a roll up your sleeves attitude in civic business and community activities. I appreciate serving with Supervisor Spiegel, our chairwoman, and taking on the many issues that come before us on an ongoing basis. And it is a pleasure to serve with you, Supervisor. I appreciate you. So let's get into it. These are questions that were provided to you beforehand, so you can think it through, be thoughtful in your analysis, work with your staff and think it through with maybe even constituents to be able to respond in a way that makes good sense. And our first question is, what are your legislative and budgetary priorities this year in support of the health and well-being of children and families in Riverside and San Bernardino counties in light of COVID, especially with regard to access to care? And obviously, there's a lot that can be said on this, but I'm going to open it up. And why don't we go ahead and start with, if you don't mind, Madam Chair, Karen Spiegel, Supervisor, if you don't mind responding to that question, and then we'll go on with Don Rose, Supervisor for the 3rd District, and then we'll end with Rosilicie, Ochoa-Bogh. Supervisor Spiegel.
There's a lot of things that we will be addressing throughout our county. One thing that we've noticed during this pandemic is that we certainly need more medical care, more primary care physicians within Riverside County. So we need to increase incentives. The physician population ratio is very low. It's like 1 to every 2,350, so 2,350 people, 1 doctor. That is very, very low for a county. So we need more primary providers. We need to reduce the number of un- and underinsured individuals in Riverside County. We have about 17.3% of adults aged 18 to 64 without health insurance, which is the worst of 25% of the counties in California. We also need to expand the number and level and complexity of jobs in Riverside County. We have a large number of manufacturing and warehouse jobs, not knowledgeable industries or tech jobs. So we need to move forward and get our families move forward and the economy in the right direction. So we need more of the knowledge and technical jobs. We just need to get people working. I think that's something that has lost this past year. It's been very challenging. It's driven families apart. It has put our children where they're not in school and at home, and you have the dynamics changing within our family system. And we certainly need to get people back to work so that if women choose to work, they can go to work and not have to worry about childcare, which means our kids have to go back to school. So it's a complex that we have to work through. And we certainly, with the kids, have to focus on reducing the educational deficits in Riverside County. There's delayed impacts. We're going to be living this at least for another decade, from the learning environments during the COVID and being at home and some of the consequences of being online for so much. And it's certainly made it worse with the challenging economic and the environment. We have to support the efforts of improving our social determinants of health. People that live, the types of work, the educational levels, the livable, walkable communities, access to public transportation or any transportation, access to healthy and fresh foods, low education levels, all these have been impacted during this COVID. And we have to make improvements in these areas. And when we do that, we'll see improvement in physical and mental health. And that is one thing that we have to watch, is the mental health, both in our children and our adults, and of course our seniors, who some of them who have been for an entire year not left their homes. So that's something we need to work through. Certainly have to support the expansion of UCR Medical School. As I mentioned earlier, with our lack of enough primary care physicians, we certainly have to support the UCR Medical School. Expanding the class sizes, hopefully result in more physicians in our community. Also incentivize providers to go into primary care and stay in the area after graduation. That's one thing that happens, is when a person goes into med school, they do their internship and they do this. And if they don't do it within their local area, they'll do that for 2, 3, 4 years, and then they get roots there and they don't come back to their home areas. And so we certainly want to entice them to stay here after graduation. And of course, we definitely need to support the expansion of our federally qualified health center networks. We've been experiencing working in hard to reach communities. And they are our trusted providers. We have some of the best workers in those clinics, and they are the ones that help reach out to those hard to reach and those lower socioeconomic incomes in our communities. So that's the beginning of it. There's a lot more, but I'll save it for my colleagues.
Thank you, Supervisor, Madam Chair, and appreciate all your points that you just made, especially the expansion of FQHCs. That's how I actually got involved with the Inland Empire Chai. I used to work for an FQHC, Borrego Health, and my heart is still there to ensure that we provide that access to care to all our constituents. You brought up a lot of great points, the need for more providers, obviously the underinsured, expanding jobs, focus on reducing the education impact because of COVID. Obviously, the online learning is very difficult for many of our kids and for our families. The social determinants of health, not only just the issue of disease or illness, but as well what is around individuals and their communities that impacts their health overall. And let's make sure, obviously, UCR Medical School continues to grow. Appreciate all your points. Thank you, Madam Chair. If we could go ahead and ask the same question of Supervisor Don Rowe. What are your legislative and budgetary priorities this year in support of the health and well-being of children and families in Riverside and San Bernardino counties in light of COVID, especially with regard to access to care?
Thank you very much, Supervisor Perez. It's a pleasure to be here today. So I represent the 3rd District in San Bernardino County, which is geographically enormous, as well as San Bernardino County being one of the largest counties in the US. So telehealth would be my answer to my budget priority. It is one of the things that we noticed that rural healthcare district, or like rural health districts, are underserved. And it is a tremendous asset to now have telehealth. It eliminates one of the biggest barriers to care in our region, and it improves access to the critically needed specialty cares that can result in a rapid diagnosis or treatment for patients. It's really one of the positive takeaways from the pandemic is the flexibility that was granted by the Centers for Medicare and Medicaid Services and the California Department of Healthcare Services with regard to telehealth. One of the legislation pieces that's pending is AB 32, and that is a bill that would require healthcare service providers by a Medi-Cal enrolled clinic to be reimbursed by Medi-Cal at the same payment rate as in-service providers. So that would be tremendous to help facilitate telehealth. And another challenge to increasing healthcare access, and I know that Supervisor Perez shares the same concern, is access to adequate internet in rural communities. Where I live in the Morongo Basin, I mean, people are surprised to find out we don't have broadband in our neighborhoods. Our school-aged children, it's been one of the biggest challenges that they have had in trying to get, even if they can't afford the technology to even pay for an internet or have a device, they just don't have the access to broadband. And so San Bernardino County is working on some leading edge technologies with a aerospace company to provide interesting and innovative technologies that we're almost ready to introduce that will really change the way that all of our residents access technology that will impact education and healthcare and have better outcomes. So that would be my number 1 priority, is increasing access to technology for telehealth.
Well, thank you so much, Supervisor Rowe. A lot of great points. Once again, telehealth, very important, especially in rural areas. You're very right on when it comes to that. I have Blythe as part of my district, and quite frankly, where I am in the Coachella Valley, 2 Blythe is an hour and 30 minutes. And obviously your district is probably larger than mine. And obviously San Bernardino County has a lot of rural areas. Thank you for bringing up AB 32 when it comes to the reimbursement that's necessary for our healthcare providers when they're providing care, and the internet. Absolutely. And the County of Riverside, as well as your county, is leading that charge of ensuring that we build the infrastructure that's necessary for internet access for all our communities. Thank you so much for your response. And moving forward, if I can have now State Senator Rosilicie Ochoa-Bogh answer the question which is, once again, what are your legislative and budgetary priorities this year in support of the health and well-being of children and families in Riverside and San Bernardino counties in light of COVID, especially with regard to access to care? Please, Senator.
Good morning, or good afternoon, actually. Thank you for the opportunity to be here today. By now, it is a well-known fact that school closures have had a significant impact on the well-being of children and families. These negative consequences range from mental health issues, increase in domestic violence, decreased access to meals, not to mention long-term disruption in the academic development of students. As a former teacher, a former school board member, and more importantly, as a parent, one of my top priorities in ensuring schools have every resource they need to reopen safely. I recently voted for SB 86. Although it is not a perfect bill, it does provide a path for school districts to implement necessary safeguards and get kids back into school, while keeping local control and safety health standards in place. This is why numerous school boards across the state supported SB 86. This bill allows for local districts to determine what is best for their communities and allocates funds for implementation. Secondly, I'm passionate about supporting Riverside and San Bernardino counties in their efforts to distribute vaccines and provide services to their constituents. The Inland Empire Caucus recently met with both counties to discuss vaccine distribution and how the Inland Legislative Delegation can partner with their efforts. And for those of you who are not familiar with the Inland Empire Legislative Caucus, it is the caucus that is represented or composed of the local electeds at the state level that represent both Riverside and San Bernardino counties. And cumulatively together, we work to advocate on behalf of the Inland Empire. I know as a member of the caucus, it is my intent to strengthen the partnerships between the inland counties and their legislators, keep the open channels of communication, and partner when we can. I know that historically, the Inland Empire has been one of the most medically underserved communities in the county, which is why we must continue to work together towards solutions that address the unique needs of our community like ours. The rural nature of our area brings about very unique challenges that require equally unique and innovative solutions. I've been encouraged over the last few years to see the way our healthcare community has come together to begin addressing these issues. With the addition of the UCR Medical School, we have begun to chip away at the doctor shortage issues our region has faced for many, many years. But we must continue to build on this success. One way that we can do this is to look at ways to expand medical residency programs within the Inland Empire. The research shows that doctors are much more likely to stay in practice wherever they do their residency. I also applaud the innovative efforts that have been made in our area to ensure access to care continues throughout the pandemic. Efforts like the collaboration that took place between the Inland Empire Health Plan, IHP, 211 Riverside and San Bernardino County, Riverside and San Bernardino County Public Health, and the CareNet Health to set up the Inland Empire COVID-19 medicine, which gives 24/7 access to health care advice for our region and uninsured residents. It is innovative solutions like these that help our region address ongoing issues with access to care. I'm also eager to listen to any ideas those on the ground who are closest to these issues have for ways of improving access to care for our residents. Thank you.
Thank you so much, Senator, for your response and for all your great points. As a former teacher myself, obviously, I understand where you're coming from. Being a teacher, when I taught back in the day, when you taught back in the day, very different from teachers today. I don't know how they do it today. Very tough job, but thank you for standing up for our teachers and for your vote, SB 86, for local control, at the same time bringing in more resources for our communities when it comes to education. You brought up the issue of domestic violence, the concerns around lack of nutrition, issues around obviously getting our kids back to school, the distribution of vaccines, obviously very important. Thank you for bringing up the Inland Empire Caucus, which is an entity in which we as an Inland Empire Chai and others have access to basically let folks know in Sacramento what the issues are, what the concerns are, and hopes that obviously we pass great legislation to support us. The doctor shortage, UC Riverside once again, and them doing what they can, working with us to ensure that we keep our kids local. We get them graduated from high school, go to UC Riverside, and they stay in our own communities. I appreciate that. The residency programs, as you mentioned, expansion of 211, IEHP, that's very important as well, and listening to the community. Appreciate you. And with that being said, Senator, why don't we go ahead and start with you on the second question, and we'll go backwards this way. What are the challenges you feel exist regarding vaccine distribution and health outcomes, both in terms of access to care in general, and we're talking about vulnerable groups, rural regions, folks living in poverty, folks of color, immigrants, seniors, you name it, overall marginalized groups. How do you plan to address and overcome these challenges to achieve equitable vaccine rollout? Please, Sandra.
So I recognize the delays in distribution are not a volunteer or venue problem, but rather an availability problem. I applaud the counties for the partnership they have forged and the logistical difficulties surrounding distribution. However, I am particularly concerned about the older population and access to vaccines. As you know, the older population is a high-risk demographic. The CDC reports that 80% of older adults have underlying health conditions, which can greatly increase the risk of serious complications if diagnosed with COVID-19. Many older adults have commented that they lack means of independent travel or are hesitant to leave their homes due to the series of shelter-in-place orders issued by the governor. This is particularly an issue in our rural region, when vaccine distribution sites can sometimes be a significant distance from the older adult's place of residence. These issues significantly decrease their access to vaccine distribution centers, even if local. Efforts to deliver the vaccines directly to these communities are important, and I will continue to have open dialogue with local health officials and organizations like IEHP, who are the boots on the ground when it comes to these issues, and provide any assistance I can in my role as a state senator. Additionally, during the pandemic, many of us have become reliant on virtual communication, virtual workplaces, virtual family gatherings, virtual healthcare, and virtual dissemination of information. I'm concerned about the segments of population that do not have access to the digital resources that have become essential for functioning in our society and for mental well-being. The digital disconnect can be detrimental to not only health access and outcomes, but also to educational outcomes, as many resources are online. This is a particular concern for a rural community. In 2019, the Public Policy Institute of California found that only 68% of adults 65 and older in rural counties had broadband access at home. They also found that 26% of K-12 students and nearly 40% of low-income students still did not have reliable internet access in the fall of 2020. While I do believe our communities will once again return to togetherness, and I do believe that school closures and mandatory lockdowns will not be the new normal, I do not know that the pandemic will have long-lasting effects on our culture. Or I do know, actually. On our culture and the way that things are done. Digital connectivity, as Supervisor Rowe mentioned earlier, will be one of them. The move to virtual platforms for meetings, forums, seminars, healthcare, and education will be integrated into our way of life moving forward. As a result, closing that digital divide and increasing access to telehealth options will continue to be of the utmost importance. We cannot forget about those populations who do not have access to the virtual world, and reasonable measures should be taken to increase online access. And I look forward to working collaboratively with my colleagues on both sides of the aisle on ways we can effectively close that digital divide and ensure that all communities have access to the tools necessary to operate in a world that is becoming increasingly reliant on technology. And let me assure you right now that at the state level, there is much conversation with regards to the broadband accessibility and the digital divide. So we are well on our work to be able to close those gaps there. And I assure you that we actively engage in that effort. Thank you.
Thank you, Senator, for your response. Appreciate your point on broadband accessibility once again, and all the other points that you made. Great statistics. I want to go ahead and move this forward because of time. Supervisor Don Rowe, same question. What are the challenges you feel existing regarding vaccine distribution and health outcomes, both in terms of access to care in general, and how do you plan to address and overcome these challenges?
Sure. And I do think Dr. Kaiser hit a lot of the challenges that both Riverside and San Bernardino County have been facing, and I thought he did it very diplomatically. I will be probably a little less diplomatic. One of the biggest challenges that I think both counties face is the lack of information that we receive from the state in a timely manner. Oftentimes, I will wake up in the morning and read a news feed that has changes to the way we're distributing the vaccine. That's very frustrating. So my one request of the state would be that we have a better communication to those changes. It's really hard to pivot on a moment's notice for all of our systems. So the constant changes are also another challenge, the state changing the way that they roll out the vaccine. So those are the two things that I believe that probably both of our counties, in particular San Bernardino County, has faced. What we have done is we have been able, much like Riverside, to use up most of the doses that are given to us. We're between 95 and 97% of all of our doses being administered. So we have a very, very high administration rate. One of the strategies that we've pursued to increase the vaccine access for vulnerable populations is partner with IEHP on a vaccination site at the Rancho Cucamonga facility for the next 6 months. And IEHP is doing extensive outreach to their members to make sure that they know when they are eligible to receive the vaccine. That site is actually vaccinating approximately 500 per day, Tuesday through Saturday. And I learned on an earlier meeting today that they hope to have that up to 1,000 per day shortly. So that's good news. And then San Bernardino County recently started a mobile vaccine program for our seniors age 65 and older. So Senator Bogh, that's good news because I share your concern with making sure that our elderly residents get the vaccine. And we do have, much like Riverside, really hard to reach areas and all of the mountain areas where we have seniors. So our mobile vaccine program is getting out and reaching those hard to reach communities. We have partnered with our Department of Aging and Adult Services to schedule appointments with their clients, but any senior in the county can access our COVID-19 website, or we have a number to call to schedule appointments for them. So that is what we are doing to try to meet the challenges that we're facing. So thank you. Well,
thank you, Supervisor Rowe. I think that Supervisor, Madam Chair, Karen Spiegel, I don't want to speak for her, but I'm sure there's going to be quite a bit of agreement there. Madam Chair, what are the challenges you feel exist regarding vaccine distribution and health outcomes, both in terms of access to care in general, and how do you plan to address and overcome these challenges to achieve equitable vaccine rollout?
Very similar. I think my two colleagues have addressed a lot of it, but getting people to the vaccination sites and vaccination providers is really critical. And we've got some issues. And one is there's mistrust of government. I mean, that's something we face at all levels, and we have to break through that and somehow gain that trust back, particularly with vaccines. There's language barriers. You know, we have some very less common languages, not just the very common ones, but we have some very unusual languages and don't have people to do the translation. And they're just as important to get vaccines. We have a large geography. Obviously, San Bernardino is a little bit bigger. And it takes 4 hours to get from Manny's end of his district to my end of the district, 4 hours to go from Blythe to up in Harupa Valley. So, and we don't have public transportation options in many parts of the county. So that is a real challenge of getting people the vaccination. And obviously the diverse geography with the suburban and the rural and remote. So These are things that very similar with San Bernardino that we are all trying to work through. And of course, the vaccination distribution is very cumbersome, particularly in the beginning. Getting it better, and I think Dawn really said it perfectly, it's constantly changing. And we hear it. Fortunately, our staff hear a little bit before us, but not much. And sometimes we'll put out a press release. By the time it gets disseminated, it's changed already. And so communication really needs to be improved. People are tired. This pandemic has been a year. People are tired. They want to get back to some normalcy. They don't want to have to keep dealing with this. Now we're having more and more people want the vaccination, which is a good thing. I know Dr. Kaiser made some words that were a little alarming that, you know, we can't go from having all this vaccination and less people to get it. And that's a fear. So we need to continually encourage people. But with the vaccination distribution, the allocations are a little bit complicated and eligibility changes with the phases and the tiers. 1 minute it goes this way, and it's a little complicated. So we need a little better way of explaining to the public because they don't understand and they get on the line of my turn or whatever they're using. And then they get all the way to the end and then can't qualify. And it's very frustrating to some of the people, or they go online to get an appointment and can't find a single one. It's only opened an hour before they got online. So appointments go rather fast right now. And so we need to get those hard to reach populations and some of the complexity and distrust worked through. And of course, one thing that's a very common one, and it's all over, and that is the limited supply. And this really has clinics and providers, makes it very difficult. There just isn't enough. So with that, we need to be building stronger partnerships with providers and ensure there's equitable allocations. You know, understanding populations that are hard to reach and the amount of vaccines that they use, and make sure we set that aside and have that. We need that clear message, being consistent, particularly to our marginalized populations, hard to reach. And now a third vaccination, having the different vaccinations with the different dosage, the times. Now with J&J, just one, which will make it a little bit easier. And that narrative is very challenging, that people would take whatever they want, whatever dose is available, because they're just frustrated. So it's really hard to work through that. So we're all dealing with that one. We also need to focus on data. You know, in the beginning, it was always about focus on science. And now as we're coming through, seeing that light at the end of the tunnel, we really need to focus on data and reviewing the case rates and death rates and vaccination rates, healthy places index rankings, and identify the areas in the communities with the highest risks and the vaccination clinics. Those have been very well, particularly our mobile teams. The mobile teams, we have 5 of them now, and they go to these places where people live and work. And I know one was the first one we did was into our skilled nursing facilities. And I know that the senator had addressed that earlier, is that aging population. We have had a tremendous focus on our senior population. And we had specific times for distribution that no one else but the senior population, and of course our first responders, had the opportunity to have those vaccinations early on. So we really worked towards that. Obviously, we have a lot more to go, but we really worked hard to reach those hard to reach ones, as well as open up to those in the community. But I think addressing how do we get to those seniors, mobile teams are very, very important to get to those. And we need to partner with community-based organizations. We've got a lot of organizations that work with us. They are able to help us with the cultural differences, the linguistics, and appropriate education. And they do a lot of the outreach campaigns with us and for us. So these community-based organizations are trusted, and they're great messengers in our communities. And we have them help with the outreach and education. So we have a long ways to go, but we get better. You know, when you don't have a rule book or a guide to follow, and as Supervisor Perez said earlier to Dr. Kaiser, you know, this has been a long year, and we've written that guide, and hopefully we'll never have to pull that guide back out.
Well, thank you. Thank you, Madam Chair. Thank you, Supervisor, for your points and a lot of great ones. And the one that I want to transition into the next question is the concern around consistency and trust. And that's a tough one. And we're obviously trying to deal with that on an ongoing basis daily. And so the next question goes to Supervisor Don Rowe, if you don't mind answering. Can you share your thoughts on how to work with those who are vaccine hesitant across all demographics and industries? And I'm sure you're feeling this as much as we are in the county of Riverside. But what are your thoughts on that, Supervisor?
Sure. I think it's twofold. I think education, and then, as Karen said, working with our trusted community partners. So how do we overcome the hesitancy of receiving the vaccine? So in San Bernardino County, we have entered into a contract using our CARES Act funding to hire a public relations firm to really create targeted messaging to various groups in the county on the importance of the vaccine. The marketing campaign utilizes TV, newspaper, internet, billboards, radio, and we are ensuring that our messaging goes to a diverse population of residents to really educate them as to the benefit. And then another strategy along with that one is to use those trusted community voices in our marketing. So for example, when we were trying to get out the message to our first responders that the importance of getting the vaccine, we partnered with our county fire chief, Dan Emcee, and had him explain the benefits and showed him getting the vaccine, and much like we did with our county sheriff as well. So kind of using those trusted partners as a part of our marketing campaign has been beneficial. And then we have an equity element group at the County of San Bernardino, and they have engaged in our faith-based leaders in the African-American community. And in fact, there's a press conference today that will announce our partnership with 8 congregations who are members of the Inland Empire Concerned African-American Churches Coalition that will allow the county to conduct vaccine events at church sites over the course of the next several weeks. And so those are the 2 main things. So education and the trusted partners are really how we're trying to overcome the hesitancy. So thank you.
Thank you, Supervisor Rowe. Can you explain a little bit more before I move on, the equity group that caught my ear?
Sure.
What is the name of that group once again? And if you could just maybe give us a little bit more info on that.
So we have pillars within San Bernardino County that we try to ensure, whether it's for education or workforce. And one of them, this last summer that was created, was what we call our equity element. And it is a combination of county employees and community partners that ensure that our mission statement within San Bernardino County is being communicated effectively with equity in mind. And this came out of the summer events and declaring that racism was a public health crisis. And how do we ensure that our underrepresented and our minority communities have access to education and healthcare and all of the things in San Bernardino County that we want for all of our residents, but taking that equity element in mind. And so we've partnered with churches, with community leaders to ensure that we are reaching those underserved minority communities.
Well, thank you so much, Supervisor Rowe, for enlightening us on that front. Supervisor, Madam Chair Spiegel, we go to you on the same question. Can you share your thoughts on how to work with those who are vaccine hesitant across all demographics and industries?
A lot easier when it's off of mute. And I certainly concur with Supervisor Rowe. You know, partnering with our faith-based community and our community organizations is critical. And we currently contract with over 12 CBOs and the Diocese of Riverside and San Bernardino counties. That's very, very important. And we have CBOs and FBOs that are trusted messengers in many of our communities. They deliver the information in a, as I mentioned earlier, that culturally and linguistic appropriate. You know, sometimes we can say a message, but if we don't really say it from the heart, it's not heard. So when you have these trusted messengers, as I like to use the word, they say it in a way that it's heard. And that's really critical when you're trying to communicate. And they're usually received well by the communities they work in. So in the hard to reach marginalized communities, you know, we put them side by side, and they provide resources and information that will help them. You know, they are our eyes in the community, and I use the word hearts in the community. And some of their leaders can use their influence. I know that we also used our sheriff and our fire chief, and you know, it's very, very effective when they see people that are doing it, you know, telling stories of those who already have been vaccinated and their experience and why it's important. That goes a long way than a government person trying to share that. You know, when we have people from all the different areas in medical care or whoever, and we want to make sure the access to vaccine is easy. We've already discussed about that, and partnering with employers and going into the community. These are all just pieces of just being able to be out there and touching. And again, it's focusing on the science to influence, you know, the vaccination of choice, healthcare providers. Science has been what's governed us. I mean, some of us don't always agree with it, but you know what? If you don't have a direction and a foundation, we'll never get to the end. So we have to stick. And if we find that there needs to be a change, then you make a change. But healthcare workers are really rooted in the science, and they respond to the data. And it makes the access to vaccine much easier. So it shows that the impact of vaccine is curbing the pandemic. We see that, and it goes back to making sure we have that data. And the most important to me is focus on community good and how individual choices impact the community. You know, we may not feel like the vaccine is important at an individual level, but we have to look at the importance as a community at whole. You know, maybe I choose not to do it, or, you know, if somebody else chooses, but we shouldn't block that opportunity for someone else. We need to encourage others. Even though children can't be vaccinated, you know, if they're under 15, we need to protect them by vaccinating everybody around them. We need to curb this and follow the science, follow the data. Thank you.
Well, thank you. Thank you, Madam Chair. Appreciate your points there. And I want to go ahead and move forward with our senator with the same question. Can you share your thoughts on how to work with those who are vaccine hesitant across all demographics and industries? What are your thoughts, Senator?
So let me just begin by stating that I have spoken to many people across the mindset of vaccination, and my thoughts will be within the context of that notion. I do believe that being vaccinated is important and should be encouraged, but it should be a choice. Prior to COVID-19, we have seen some serious viruses and illnesses brought under control through vaccination. Having honest conversations with the community and being transparent with our constituents is key to easing the mind of those who are vaccine hesitant. We should seek to educate and provide information to these groups. For a significant period of time, we knew very little about the virus. In an effort to head off serious consequences of the virus, medical experts were advising policy makers according to the best information they had at the time. However, in this type of situation, inconsistencies will inevitably occur. As we learn more about the virus, advice and guidelines on best practices have changed multiple times. It is only it's only natural that many members of our community are experiencing information overload and to be skeptical or confused. Unfortunately, the issue became political, and us versus them mentality only increased hesitancy and distrust about the vaccines. Additionally, in many segments of the population, there exists cultural distrust toward government that will not be overcome with government mandates. Efforts to silence and shame these groups of people who have concerns about vaccines have not been helpful in reducing vaccine hesitancy. Moving forward, I believe the best way to address the vaccine hesitant population is to promote the benefits of the vaccine, promote the success of the vaccine, and foster and encourage open and honest conversations. We must listen to the real concerns that people have had and work to alleviate those concerns, not to dismiss them. And that's how we're going to build the trust within those communities.
Thank you, Senator. I appreciate your point. Not make it mandatory. People should have that option, should have that choice. I agree with you. Although I support the vaccination, for example, and I'm still waiting for my turn, but I'm also not imposing my view, quite frankly, on others to be vaccinated. If they so choose, by all means, when it's their turn, if they so choose not to, by all means as well.
And by the way, I will be vaccinated when my opportunity comes.
Right. I'm still waiting. And so with that said, thank you. And this is the last question. I'm going to raise the question, but then, folks, I'm going to turn this back over to Allison because my vote is coming up. And I've been already, my staff has come to me already and said that it's about less than 5 to 10 minutes. So I'm going to raise this question and I'm going to turn it over to Allison. And it's been a pleasure to MC this for the little time that I had and to work with all of you and obviously consistently working with you over the years to come. How can individuals and community organizations support your or the efforts to achieve widespread vaccination programs? You already responded to some of this, and ultimately herd immunity, especially in terms of access to care for families and improving health outcomes. Allison, I'm gonna turn this over to you. And let me just say thank you, everybody.
Thank
Take
you,
care.
Supervisor Perez. You rock big time. Thank you and good luck to you.
Thank you. Take care, everybody. Love you all.
Okay, you too. We appreciate you. All right, let's see. So why don't we go ahead and start with you, Supervisor Spiegel. Would you like to take that question first?
What if I said no?
Well, I would very respectfully move on.
I mean, it really goes back to some of the things that we've been saying in the message, and that is our community and faith-based organizations to get their support. And we need them to support our efforts and continue to partner with us to reach the community. They reinforce and amplify, the public health messages that we get out there. And they do it in a way that will be received and heard. And I think that's really what we're trying to do is, how do we get the message out? How do we make it sound important enough for people to step up and do the vaccine? If someone's adamantly opposed, you're not going to change their mind. But we need to get enough people to make the outcome of being effective, and that is that herd immunity that we keep hearing about. Individuals can think beyond themselves and focus on the community, but getting vaccinated gets us closer to that. So we need to protect. I always say when we were talking about the businesses and following all the rules, if you don't do it for yourself, do it for a business, do it for your family, vaccinate for your family, or at least encourage others if you have some reasons that you don't want to, and it's really difficult. We have to continue to wear the mask, keep our distance. And, this large gatherings, I don't know when that's going to be. I think we need to keep revisiting because the longer we have people with businesses closed and the longer we have the kids only partial day and not easing back in, we're starting to make some progress. It's very exciting. So we need to stay focused on the light at the end of the tunnel, and we have to work together. I know it's challenging, and listen, I'm frustrated. My family's frustrated, but we're going to get through this if we do it together. And I think that's the biggest key is we need to reach out and get everybody together and focus on that point.
Yeah, you're so right. Thank you. Thank you very much for that. Supervisor Rowe, how about you? What are your thoughts on this?
So we are actively looking for community partners to help us roll out the vaccine program. It could be members of the medical community, including physicians, nurses, could be dentists, trying to get them trained and help with the distribution of that. I just received an email while we've been on here that provides really good news. I think I will share with you that the County of San Bernardino next week is going to get 12,000 doses of the Johnson & Johnson vaccine. And we are looking at rolling these out because it only requires 1 dose and it doesn't have the deep freeze requirements of the others of Moderna and Pfizer. So our strategy is to try to find the small physicians, like small family practice physicians in remote areas where they don't have the storage problems, and have them help get the 3 populations that we're looking at getting, which is incarcerated or homeless, and then those that are homebound in hard to reach places. And so that's exciting news. And then the other thing is that we've been pretty creative in partnering with some of our transportation authorities. A lot of them have buses that are not in use right now, and utilizing those to get the vaccines out and to distribute them in the far reaches of the county. So much like Supervisor Spiegel said, the community partnerships that we have, and then encouraging those that are in the medical or dental field to get trained to get the vaccines in arms sooner than later. So thank you.
Wow. So we're getting there.
Yeah.
Awesome. All right. And how about you, Senator Ochoa-Bogh?
Absolutely. So individuals and community organizations can work directly in the segments of populations that have barriers to vaccination and other healthcare resources. This is why local control is so important. Counties, cities, and community groups are the boots on the ground. This is especially true for nonprofits. They have an understanding of what segments of population need to be, population need more assistance, and how to best assist them. We must provide the support necessary for these nonprofits to continue doing this important work. We must also do a better job of educating the public and making them feel at ease. There has been much confusion throughout the pandemic as a result of ever-changing guidelines. People are experiencing information overload and don't know what to believe. Those closest to these communities have the best opportunity to be a trusted voice on these issues. People are more likely to listen to those in their community who they have an established relationship with. So the role of community organizations like IEHT is going to be vital. The answer is not to force vaccinations on people, but to educate them on the benefits and the science behind them. I know this is the type of great work that is being accomplished, and while I am very appreciative of the hard work you all do to ensure improved access to care, please do not hesitate to let me know how I too can be a partner for your organization. And if I may add, just wanted to let you know, with regards to Supervisor Rowe's concern with communication at the state level, let me tell you that the legislators are feeling exactly the same frustration as you are here at the county level and the city level. As a matter of fact, it's one of the reasons that prompted our efforts to submit a bill that I just introduced, SB 3336, which basically mandates that the California Department of Health give 72-hour notices before any of these mandates are forced into being in effect. So it was with that intent to try to communicate a little clearer and better and more efficiently that we submitted this bill. So hope to have your support on that endeavor, and thank you for the opportunity to speak today.
That's wonderful. Very good to know. Thank you. And before we move on, I didn't want to cut you out, Dr. Kaiser. I don't want to put you on the spot. Did you have anything else you wanted to say on this or any of the other questions or topics that were discussed with the panel? Or we just didn't want you to feel like you didn't have an opportunity to address any of those things that were brought up? Or do you feel content with what was discussed?
Well, I don't want to belabor any points, and I've certainly talked enough, I think, but I will point out that we don't want to be in a situation, and to use youth sports since that's been in the news a lot, we definitely don't want to spike the ball before we're in the end zone. We're not to a point where sufficient numbers of our population have robust immunity yet. We need to get the vaccine out there to make that possible. And until then, I know that people are tired and we've asked them to do a lot. And if we can just keep the lid on until then, I think that we can actually have a much better result and much more quickly come back to something that approaches normal.
Thank you. That's very, very valuable for us to keep that in mind. Thank you. Well, that was fantastic. That was a wonderful exchange. We appreciate that. So now we would like to move on to the question and answer session from all of you. And to do that, we'd like to see some hands raised. And I do see one from someone we know well. So I'm going to let Soteria Cobb take over this segment here so we can sure we are going in the order of those hands that were raised first. So Soteria, why don't you go ahead and start calling on the first hand.
Hi, Dr. Hansen, you have a question?
Hey guys, yes, I'd first like to thank the entire panel for your presentations today. It's good to know that you guys from the legislative level and our county levels are really working on these issues. And one thing I wanted to bring up, and I know Senator Ochoa-Bogh, you had mentioned about hearing from physicians in the community and what could potentially be done. And I think one thing that we're going to learn from this pandemic is that we need to be more nimble in how we deliver healthcare. And I think we've had to figure that out, significantly with the vaccine rollout, but it'll continue to be an issue because not everyone will be able to be vaccinated for reasons that are multiple, but maybe there's allergies, maybe they decide not to do it. So we'll most likely be seeing this virus as part of our community for potentially even years to come, hopefully at very low levels and maybe even only seasonally. The point I'm trying to make is that we'll have a need, I'm sure, to utilize telemedicine in a way that we never did before. And yes, there are strategies that we need to incorporate on how can we get that ability out to underserved areas. I think one category, though, that will be significantly impacted is going to be our senior populations, the 65 and over, the more fragile population that is potentially more at risk, and those individuals that maybe cannot be vaccinated, that don't, will still be handled in a more cautious way. And so we may need to utilize telemedicine continually, even if this pandemic it settles down significantly, like we hope it will. So I think the point I'm trying to make is it's important to know that we have folks at the legislative level that can communicate the need for continued reimbursement of telehealth at the levels that we're at now, because what will happen potentially is there will be a rollback by the health plans on reimbursement of telehealth because they'll think it's not necessary anymore. And that's what we've seen in the past. And so I think that as long as we're all on the same page with that and realize that things probably won't return to something normal for quite a while, that's going to be something we're probably going to be really having to battle.
Thank you for the point, Dr. Hansen. I appreciate it. We'll keep that in mind for sure.
Thank you.
Thanks, Dr. Hansen. How about anyone else?
Oh.
I'm not seeing any other hands raised.
No, let me look at the questions.
Well, I have a question then. I'm raising my hand here visually. And this may be geared for Dr. Kaiser, but anyone else who has any knowledge of it. I'm curious about international travel. And yes, I'm just having a bit of wanderlust. It's been many, many years since I've taken a really exotic vacation, but it is on my mind. And I've seen that places like Thailand and even Singapore, which usually seems to be so advanced in so many areas, they are obtaining their vaccine from China. I can't remember what their vaccine manufacturer is, but anyway, Sinotech or something. But anyway, when do you think that countries like that are going to be catching up or more widespread in terms of their vaccine rollout? And I guess it's a function of government, manufacturing, and all kinds of things. But what do you see in terms of that timeline?
Well, without commenting specifically on the particular Chinese vaccines, because the data on those is relatively inconsistent. Nevertheless, there will be a lot of communities countries that end up using it simply because China is trying to distribute them more widely. The point is, though, is that by you being fully vaccinated, the idea is that you don't have to worry about that problem nearly to the same degree. In fact, we do expect the IATA, which is the International Air Travel Association, is likely to develop a vaccine passport-like application. I'm not sure what that was. Which would, be able to demonstrate when you're entering one of those countries that you are fully immunized. And it is also possible that some airlines may require it as a condition of even getting on the plane. For example, Qantas, the major Australian carrier, their CEO has declared that non-vaccinated individuals will not travel on certain flights. The upshot of that is even though the vaccines are not perfect, they would remain your best protection in those countries. And we would presume that there must be at least some level of protection that they cover. From what little we know of them, we do know that they use relatively conventional adenovirus vectors, which should have same or similar, at least, protective capability. But the most important thing that will get air travel going back again is to make sure that we all get immunized. And as countries that we might be traveling to come on board, we can take confidence in the fact that we will be protected as we travel.
Okay. So you think they will loosen up some of their regulations to allow us in if we are vaccinated to some degree, you think?
The country I have the most familiarity with is Australia because my wife is Australian. And in fact, there was a period of time where we didn't see each other for the better part of a year because of the severe border controls that Australia has implemented, which to their credit has worked out very well. They have extremely small numbers in Australia and New Zealand.
Right.
But by the same token, it has also made travel extremely difficult. And
Right.
they have generally thought about is opening up larger and larger travel circles. For example, they might think about a low prevalence country where vaccination is relatively common. A good example of that might be South Korea or Taiwan. And then move up to lower prevalence countries where vaccination is also higher. That might be Singapore, it could be Thailand. Thailand has been actually fairly comprehensive about their restrictions. High burden countries with high vaccination rates may be lower down on the list. That would mean the UK, that may potentially mean us. Even if we were fully protected, some countries may still want the US to wait later. I would imagine we would not be as high on that list because we also bring a lot of tourism dollars to those countries and they would like to see them again. We may be further down the list than some of the other ones. Obviously, countries like New Zealand would be the top of everybody's list because New Zealand, other than occasional sporadic outbreaks, has virtually none spreading in their community.
Wow. So interesting. So many dynamics. All right. Soteria, I see another hand.
We do. And this is from Rosilicie Ochoa-Bogh.
Ochoa-Bogh, yes.
Yep.
Hi, and this question is for Dr. Kaiser. With regards to the vaccines, I'm a bit curious. I've had several questions and been brought up throughout the district and in California, but I'm not quite sure how to answer. With regard to the vaccines and understanding that the virus has mutated several times, when we receive a vaccination, how do we know, or does it matter which version of the virus is being used to manufacture the vaccine?
What's important to point out about vaccine manufacturing is that virtually all of them deal with an artificial virus, if you will. For example, the messenger RNA vaccines, and those types are Pfizer and Moderna. They don't use the viral genetic code as it comes in nature. They've already made substantial modifications to it. What those vaccines are trying to do is to get the nucleic acid sequence that codes for what they call the spike protein. That's the portion of the coronavirus that's used to enter cells, so that your body will form antibodies to it and then interfere with the virus's ability to bind. Those nucleic acid sequences are already substantially altered for a variety of reasons, most notably so that the immune system won't destroy them and your body actually does something meaningful with them. Even for a vaccine with a more conventional, we'll call adenovirus vector, this is different. Let's take the Johnson & Johnson one as an example. What that is it's a virus called adenovirus, which they basically scooped out its insides and replaced it with genetic material which is similar to the virus. And then your body would react against that. Again, that's not a viral sequence that exists in nature. What we're trying to find out, of course, is that do these generate a sufficiently general immune response that if you happen to be infected with a variant, that your body would be able to fight it off. So far, the initial data seems to be that all three of these at least have reasonably good immunity against the known circulating variants. Now, a virus's natural tendency is to mutate, because the more that it replicates in a particular person, viruses never have particularly high fidelity replication machinery, and part of their survival strategy is to make a whole lot of errors. Most of the time, this makes a virus that doesn't work, but occasionally it will make a virus which is better able to infect or better able to spread, and that one, because it's more fit, will eventually take over. The idea being is that we would have a sufficiently generalized response that it doesn't matter which variant you get infected with, your body is able to respond to it in the same way. For the variants that we know about, it seems that the three that are on the market right now do seem to be able to give you adequate protection, but we must keep our eyes on them, because as new variants emerge, we need to make sure that the same thing is true for those as well.
All right. Well, we won't keep you all day, but I do have one more question. If we don't have any other hands raised at the moment, I would like to, I think this is for Dr. Kaiser as well. I've heard so much about the effective use of monoclonal antibodies, and we've heard a lot about that. That's what was so successfully used on President Trump. Why is that readily or not readily available? And if not, why not? If yes, why is there a perception that it is not? Because that is, to me, that's kind of the perception, that it's a difficult thing to obtain. Is it a supply issue? Is it cost? Or is that in fact a myth, that it really is easily obtainable?
At least initially, for a number of the monoclonal antibodies, and I'll explain briefly what those are in a second, but at least initially it was a supply problem, because we had relatively small amounts of it, and it's somewhat more expensive to manufacture than typical medications. What a monoclonal antibody is you have made a particular artificial antibody which responds and binds to a particular portion of the virus. Essentially, you're harvesting the antibodies that would presumably confer some level of immunity that your body is not already acting against. For the initial time when those monoclonal antibodies received their emergency use authorization, they were quite scarce, and it was difficult to get them in large quantities, which is why the federal government and the state government stepped in and issued controls on the amount that any individual hospital could order to prevent them from cornering the market. When we received those in Riverside County, for example, every week I would get a spreadsheet from the emergency management department. I would look at the hospital census, and then I would divvy out to each of the hospitals, based on how badly they were affected, the amount of monoclonal antibody treatment they could order. If they had a lot of patients in their ICU, for example, we would give them more. Now, the more recent ones, like, and I always mess this up, but I'll try and pronounce it again, bamlanivimab, is possibly the least pronounceable medication in medical history. That one is a little bit unusual, because that's designed to be used outside of the hospital. It is intended to be given to people in emergency rooms or infusion centers to prevent them from being admitted, because it actually didn't seem to show any improvement for people who were actually admitted and received the medication under those circumstances. That's actually less useful than it seems, because during the portion where we had the surge in cases, the emergency rooms really needed those beds for patients they actually were going to admit. Having somebody sit around for an hour to receive an infusion of a medication which may or may not help them didn't seem like a great idea. There is some evidence that it helps, but again, because it has an emergency use authorization, it has less data than other more typical therapies which we may use for other illnesses. At this time, though, there is no national shortage of monoclonal antibody therapy. Naturally, everybody is concentrating on vaccines, because I'd rather prevent people from having COVID-19 than have to treat them. But there is still the ability for hospitals to order them. They can order them directly from the manufacturer. And for those who unfortunately do become ill, and that is still happening, they can literally be the difference between life and death.
Thank you. That helps. Understand it. Oh, it looks like Dr. Ken Lane has a question. Hi, Dr. Lane. You're on mute, Dr. Lane.
Okay, I'm off now.
Okay.
Well, look, all of you, I just want you to know that I came into this meeting with an open mind, but a little hesitancy, and I am so impressed by our supervisors and our senator And Dr. Kaiser, you're amazing. You know,
Mhm.
we are really lucky to have all of you in our community to fight this pandemic. I'm also encouraged that the Inland Wellness Information Network, the nonprofit that's associated with the Medical Society, is also focused on the African American and Hispanic communities, because historically they've had a lot of issues with medicine, and for very good reasons. So we're trying to use this as an opportunity to inspire them to trust their doctors. I mean, keep in mind, 30% of nurses don't want to have this vaccine either. So we've got a big problem on our hands, and that all of you are looking to partner with the African American churches and maybe the Catholic churches. I'm really excited about. But my biggest concern right now is that the COVID-19 deniers and the states that are going to be starting to open up 100%. Just yesterday, 7 people in San Bernardino County died of COVID and 20 people in Riverside. And the 7-day average for COVID positive patients is 3,592. So 3,592 people have tested positive in the last 7 days in Riverside. So I would just like maybe Dr. Kaiser or others to comment on what we're going to do when the deniers begin to become vocal. Thank you.
Well, I'll go ahead and start, and then if our chair wants to add any additional comments, but I'll certainly say that we've tried very hard to make the point to people that precautions are still necessary, and I think you've put the point on very clearly that we're not out of this yet. I've said, and I said this from the beginning, that it's not over until there's a vaccine. And now that we have one, though, it's still a matter of making sure we do the logistics to get them out to people. The thing that's been the most challenging about this pandemic from the beginning is it's just dangerous enough. If it were a disease like Ebola, where you had it spread through a community and had a substantial potential mortality rate, especially for people who couldn't access an ICU, I don't think we'd really be having any questions about this. But COVID-19 is just dangerous enough where it kills just enough people to make it substantially more dangerous than the flu, which it clearly is not in the same mortality category as. But it also spreads asymptomatically through other populations, and it can be a real burden on those people who don't seem to be affected by it, but have to be mindful of its effect that it can have on others. And that, I think, has really exposed some of the fracture lines that already exist in our society. The most important thing that we can get out there is to remind people, you know what, this is what works. Places that have actually done it have had improvements. And even if you don't think that that's what's needed to do, please help us with the vaccination strategy, and let's get rid of this for good.
You know, it was, I think it was Supervisor Chair Spiegel that mentioned we should not be mandating, vaccines. I think we shouldn't be mandating masks and social distancing either, but, and I am a Democrat, but I still believe that we should not mandate it. We need to inspire the community and the deniers that this is a powerful infection and it may kill their family members. We need to inspire them.
I couldn't agree with you more, Dr. Lane. This is something we struggled with early on last year. We were the first county out when Dr. Kaiser did a mandate on masks. And at that time, we were looking forward to things were calming down, because at that time, the focus was only on hospitalizations, because we didn't want to overwhelm the hospitals. And in preparing to get in line to open, we chose to no longer have a mask mandate, but rather encourage masks. And that started in our county such a partisan political mess.
Yeah, I know.
And this COVID bug does not care if you're a Democrat, a Libertarian, a Republican, or whatever. And it's really was frustrating, and tried to explain that the reason for it, and it was a 5-0 vote, and we have a very diverse board. And it was simply to be in line. The state didn't have a mandate, and we were trying to be in line with the state, so that when the time came, we were excited. We were really convinced we were going to be opening soon. And of course, That was in May, and then by July, it just turned so badly. That was the first major surge. And then we just had the surge in Thanksgiving, and then the surge after Christmas. And, it was just the fact that we didn't inspire enough. And now more and more people are not being inspired, and it's just a real challenge. And it's fatigue. It is the COVID fatigue. And it's very hard to continue to tell people, and it's been a year, so.
But continuing to work with our churches and our community leaders, that the people who don't trust medicine or don't trust politics will listen to. And I love the idea of using the billboards in our county to educate as well. You're doing an amazing job, all of you.
No, thank you. Thank you for everybody's support here. As I said earlier, there just isn't a manual. There's not a book. There's no plays that we were doing. And the county under the leadership of Dr. Kaiser, we've done a lot of plays and created new ones. And it's been a challenge. And I'm very sincere when I say, I hope we never have to bring that playbook back out now that we have one. So.
Well, thank you very, very much for those comments. That was great. We did have to let our Senator Ochoa-Bogh get to her next meeting right now. So thank you so much, Senator. That was fabulous. Your input was just invaluable today. So thank you for joining us. We really appreciate it. We will see you next time. You're on mute, but we know you're leaving anyway. So we'll see you soon. Thank you. All right. And short of seeing any other questions, we don't see any other raised hands. This is your last chance, folks. We will go ahead and wrap things up. So we do want to say a few final words and thank everyone. I want to thank the board of the IHI. In addition to myself, I want to thank Alex Bravo with Molina Healthcare, whom you heard from earlier. And we want to thank Lisa Schifano with Riverside County Office of Education, who's on the call today. Lisa, give us a wave there. Thank you. And Kevin Mahaney with St. Mary Medical Center. And I think Kevin's on, but I don't think he's put his beautiful face on there yet. But he is the chair of the Advocacy Task Force and was responsible for developing much of the content and the questions behind today's forum and lining much of this up. So we appreciate that. And Ronnie Robinson as well with First Five San Bernardino. So thank you all to the board members and the Advocacy Task Force for all of your hard work and all of your dedication to the IHI. We also want to thank our steadfast and dedicated consultant, Victoria Stephen. Victoria, give us a big old wave there. We thank you so much for all you do. And like I always say, thanks for keeping this train on, not only on the track, but running, keeping the engine going. So thank you very much. We truly appreciate it. You really do a lot for the CHI, and it wouldn't run without you. So thank you very much. And it's fun to work with you. Let's see, then of course, most of all today, we do want to thank all of our participants. So thank you to our Emcee Supervisor V. Manuel Perez and our amazing keynote speaker, Dr. Cameron Kaiser. Thank you to California State Senator Rosilicie Ochoa-Bogh and Riverside County Supervisor Karen Spiegel and San Bernardino County Supervisor Don Rowe. So let's see, who else have I left out here? I think I've thanked everybody I need to. I've probably left someone out, but if I have, you can let me know. I do want to remind everybody to please join us on May 4th for our quarterly health education forum, and that will be on Zoom at 12 noon. Our topic will be announced in the very near future, and we'll have a flyer that we'll distribute with sign-up information for that. It will be something very engaging and timely, so we hope you'll plan to join us for that. Don't forget to sign up for our Facebook page, IHI Facebook page. We have a lot of updates and announcements on there that you don't want to miss. So join the activity on our Facebook page. other than that, I think that's it. We thank you all for everything you're doing every day. And we most of all appreciate you guys for being here and giving of your time and all your talent every day in your work and in your life. So thanks everyone. And we wish you all just a fabulous weekend.